Now, just a few weeks after Ebru TV carried out an investigative piece about the plight of cancer patients seeking medication abroad, Kesses Member of Parliament Mishra Kiprop has now drafted a bill that seeks to regulate patients from flying outside the country. Mishra, who is also the Vice Chair of the Parliamentary Health Committee, says the country is losing about 10 billion in revenue to foreign nations, whereas Kenya has adequate health facilities ready to combat majority of the illnesses. Now, Jeff has the rest of the details.
Because when you mention cancer, people start planning for your funeral.
So from December last year up to now, I'm buying the medicine for myself, 40,000 per month.
Because like now approximately I used about 500,000. And maybe it's more than that.
I chose India, it was cheaper, but we've spent millions of money. Over 20 million.
The Shylocks of cancer is a story highlighting the challenges of a section of the patient seeking medication abroad.
But what the bill is going to aim for through lawmakers, that we want to manage our referral in a professional manner. The absence of law can be an opportunity for the people who are crooks, who are brokers, who are agents, to manipulate and misuse the innocence of the people.
Cancer disease, besides causing pain and suffering, causes the victim families to slide into bankruptcy due to the huge cost it takes to treat it. However, in a bid to salvage the situation, Kesses Member of Parliament Mishra Kiprop has now proposed a bill that seeks to regulate the patients from flying abroad.
We want to vet the hospitals and the doctors outside country for the respective countries. We should be identified and acknowledged and vetted and should be recommended.
Over 10,000 people travel abroad each year to seek medication, and among those, a staggering 70% are going to seek cancer treatment. It is said the country loses about 10 billion Kenyan shillings through medical tourism.
The crooks, the non-medics, the conmen, the agents, the brokers, they are deciding the fate of a patient who needs a high-end or subspecialty treatment outside the country. Then, collusion. Collusion between the quacks and some medical workers.
Dr. Mishra Kiprop, who is also the Vice Chair of the Parliamentary Health Committee, and Professor Stanley Khayenga, plastic surgeon, says most of the patients who have sought foreign medication have come back in caskets.
And it's because of corruption. Corruption. There's 10%. Na watu yetu sasa wanasukuma hiyo, wakipeleka mgonjwa huko, kila mtu anapata share yake. So they would rather have the patient go to India than treated here. And
some countries have good facilities, world status, but there are also conmen there. There is also quality, less quality performed hospitals are there.
The stories of greed, a lack of professional ethics and worship has bedeviled one of the most respected careers that so many wished they had chosen.
There are more doctors in this country now, more brokers than doctors, treating doctors. So surely, in the 5-star hotel, doctors are coming, seeing the patients. We don't know. We don't know who is coming, who is doing which camp. And also, there is people without certification. We don't know they are quacks or what. So everybody is touching a patient of Kenya in that country outside. The government should know. They should be accountable.
The National Hospital Insurance Fund spent about 1.36 billion Kenyan shillings as payment towards the treatment for the cancer in the year 2017-2018 financial year, an increase of the 11% from the 1.23 billion Kenyan shillings spent within the same period in the previous year. This is likely to go higher. Reporting for Ebru TV, I'm Jeff.